Hi everyone, Dr. Nemechek here. I want to talk to you about how these food allergies are related to leaky gut or intestinal permeability, something we see all the time. This is a recent paper here, actually from Russia. So evaluation of biomarkers of intestinal permeability and inflammation in food allergies. All right. Now basically they have kids with atopic dermatitis, and then kids with just straight up food allergies, and they looked at them and they looked at markers for leaky gut. And so what you see here, so here is atopic dermatitis and food allergies. These kids show high levels of IgE. That's one of the common antibody tests they're looking at when you're getting your allergy testing done. They had hypersensitivity tests to a number of foods like cow's milk, egg, fish, wheat. All right. So they're showing a lot of your typical allergy phenomena. And they showed zonulin levels were increased in these kids, especially ones with moderate food allergies. And zonulin, increased zonulin is a marker for leaky gut. Okay. They were also showing the calprotectin level in the stool was normal. So that means there wasn't inflammation, like a true inflammatory reaction in the gut. Now, I want to talk to you. So here's the small intestine, okay, cut away. This is actually of a mouse. Ours is the same except for these little things called villi are smaller. And you have a single barrier here. And when you leak in, 70% of the body's immune systems are just right here on the other side, okay? Wrapped around that whole thing is most of your immune system, including your mast cells, your eosinophils, your basophils. These are all the cells that are responsible for allergic reactions. And so when things are leaking in from leaky gut, you're going to trigger a lot of these food allergies that way. Now, they aren't really allergies in the way we tend to think of them, that just forevermore. Like, I'm allergic to my cat. I've been allergic to cats for my whole life. I'll be allergic to cats the rest of my life. Doesn't matter which cat is around my house, okay? But here, what we see is kids are showing and adults are showing these food allergies and being told to avoid these foods, and it's really not a true allergy. They're just picking up in these tests that the food particles are leaking in here and causing this reaction that then they're detecting in a blood test. And when you fix leaky gut, often it all goes away. All right? And many of these kids, when the parents get the testing, they're like, we didn't know. He seems to tolerate it just fine. We don't think there's a leaky gut here. I mean, allergy, because it's not really. It's a false positive, really, in the truest sense. And in terms of leaky gut, so this little barrier here, along here, okay, is this single line here. So here in the far left, if you don't have a lot of overgrowth, there's typically, that's what, no leakage here. Here's when you have SIBO, the excess bacteria. We talk about using rifaximin or other antibiotics or inulin to stop that. And that leaks between the seams, okay, into the cells. So food particles can leak in there, trigger these white blood cells, and now your test is positive. Well, if you fix SIBO, that stops and the test turned to negative. All right. COVID has a different pattern, and here's a whole list of other things that can be causing leaky gut and giving you those false test positives. So something to think about. Just because those tests are showing some positivity doesn't mean you necessarily have a real allergy, especially if there's no symptoms. Okay. Well, that's all for today. Remember, hit subscribe for me, and remember, take care of yourself, take care of your kids, keep your inflammation down. And until next week, this is Dr. Nemechek. Take care.